Bismillah ar-Rahman ar-Rahim. This is the revision of slides for the first year. As regards the high power slides, they are 10 in number. We have the simple squamous epithelium, simple cubical epithelium, simple columnar epithelium, pseudostratified columnar ciliated with goblet cell, non-keratinized stratified squamous, keratinized stratified squamous, transitional epithelium. These 7 are for epithelium. And we have, after that, we have 3 types of nerve endings. We have the muscle spindle, we have Pacinian corpuscle, and we have finally motor end plate with silver. These are the 10 high power slides. How can we differentiate between them? That will be seen. The first slide is the most easy slide because of its characteristic color. It is the motor end plate. Between 2 brackets, AG, that's the special stain. Why it is the most easy slide? Because it is the only slide in the 10 high power slides stained by the brown color. As we see, these are the longitudinal sections of the skeletal muscle fibers. These ribbons, parallel ribbons, are the skeletal muscle fibers parallel to each other. And then we have, this is the motor nerve coming to this muscle, supplying it. And at the area of contact between the nerve and the muscle, we have this nerve ending, which is called motor end plate. But take care, it is an easy slide, but most of you forget to mention the special stain, which is silver. So it is very important to mention the stain, which is AG or silver. This is the second high power slide. It's also very easy because it is a slide of the Pacinian corpuscle. As you see here, the Pacinian corpuscle is formed of concentric lamellae of modified Schwann cells. They look like sliced onion. So this appearance is very characteristic for the Pacinian corpuscle. You see these circles with the blue dots here representing the nuclei of the modified Schwann cells. So this is the Pacinian corpuscle. This is the Pacinian corpuscle. This is a Pacinian corpuscle, Pacinian corpuscle, Pacinian corpuscle. These are of characteristic holy appearance or looking like sliced onion. Again, this is a picture for the Pacinian corpuscle, characterized by this holy appearance of the modified Schwann cells, and in the center here we have the axon terminal. So this is the Pacinian corpuscle. This is the third slide in the high power. It is also for a nerve ending. As you see here, we have this small capsulated structure, this capsule here, red capsule, and inside it we have a white space, and inside also we have few red fibers. These are the intrafusal muscle fibers. Among the outside this nerve ending, we can see transversely cut skeletal muscle fibers. So in this slide here we have what? We have this capsule, and inside we have a white space, and then we have fibers inside. These fibers are the intrafusal muscle fibers, and outside this muscle spindle we have these bundles here of transversely cut skeletal muscle fibers. They are not evident here, the muscle fibers of the skeletal muscle. Here we have these fibers. These fibers should be smaller in size compared to the fibers of the intrafusal muscle. So we have here the transversely cut skeletal muscle fibers, and here it is the intrafusal muscle fibers. So if you have a capsule, red capsule, white space, and inside we have red fibers larger than the composing fibers of this bundle, so this is the muscle spindle. Now this is the first slide in the epithelium. In this slide you can see this is the glomerulus. This is the glomerulus in the Malpighian renal corpuscle, and at the periphery we have these flat cells with flat nuclei. Look at the picture. We have these flat blue dots of the simple squamous cells nuclei. So this is the epithelium of simple squamous epithelium surrounding this group of blood capillaries forming the glomerulus. So this is an example of the simple squamous epithelium. So this slide is simple squamous epithelium. How can we know it? We can know it by the fact that the cells here in the simple squamous epithelium, the cells here are denoted by the flat blue nuclei. So as they are flat, the cells are flat, and the epithelium is a simple squamous epithelium. The second type of the epithelium here is the simple cubical epithelium. If you see here, these are the cells at the tip of the arrow. These cells are known by the shape of their nuclei. The nuclei here are rounded. And as we see here, this is the simple cubical epithelium. I can know it by the fact that the cells here are cubical and the nucleus is central rounded. Of course, you cannot see the outline of the cell. You cannot see this outline, but you can see the nucleus. The nucleus here is rounded and separated slightly from the base membrane, and it is in the form of one layer. It is only one layer, so it is simple. And as the cells are cubical, as noted by the shape of their nuclei, rounded and not resting on the base membrane, so it is simple cubical epithelium. Take care also that most probably the slide for the simple cubical epithelium, it is coming from the thyroid follicle, and here you can see the colloid secretion pink inside this follicle, but this is not always the case. You may have simple cubicle in other side, but it is the most common to bring the simple cubical epithelium from the thyroid follicles. And here we have an additional observation, which is the colloid secretion inside these follicles. This is the follicle, and this is the colloid secretion inside, which is the thyroid hormones stored inside the follicles, and it is always pink in color. So it is an additional observation to be sure that it is a simple cubicle. But take care, we can bring a slide for simple cubicle other than that in the thyroid, but you will also denote it by the shape of the nucleus and its position. This is another type of epithelium, which is here the simple columnar epithelium. In the simple columnar epithelium, you can know it by the shape and the position of the nuclei. The nuclei are columnar or oval, are oval in shape, and they are resting on the membrane, no space in between the nucleus and the base membrane, and the cell is tall here evident by the red color of the cytoplasm. So this is the simple columnar epithelium, and we can know it by having this shape of the basal oval nuclei here resting on the basement membrane, and the rest of the cell will be seen as the red color above this basal oval nuclei. So this is the simple columnar epithelium formed of one layer of columnar cells. Another slide for the simple columnar epithelium, and as you see we have here the basement membrane, and this is the epithelium here, and this epithelium is formed of one layer because I have just one layer of basal oval nuclei, so this is a simple columnar epithelium. And underneath this epithelium you will have these nuclei of connective tissue cells, and we have the connective tissue fibers also. So the diagnosis of this slide is the simple columnar epithelium. Another slide for the epithelium in the high power slide is the pseudo-stratified columnar ciliated epithelium with goblet cell. Here we have two rows of nuclei. This is a basal row and another one above it. Then we have this red area representing the cytoplasm of the tall columnar cell. Then we have these tiny hairs which are the cilia. Among these cells you can see these empty spaces representing the body of the goblet cell. So this is the pseudo-stratified columnar ciliated epithelium with goblet cell. We can see this picture. We have here, this is a basement membrane, and then we have above this basement membrane we have the nuclei of the short columnar cells, and above it we have nuclei of the tall columnar cells, and then we have the top part of the cell, and above it we have these tiny hairs of the cilia. Also you can see an empty areas here representing the goblet cell. Empty areas or white areas like this one representing the goblet cell. So this is the pseudo-stratified columnar ciliated epithelium with goblet cell. Don't forget, it is pseudo-stratified columnar ciliated epithelium with goblet cell. Also look at this picture, it is also pseudo-stratified columnar ciliated epithelium with goblet cell. This is at first the basement membrane, and then we have two rows of these rounded nuclei, and then we have the rest of the cytoplasm of the cell. Here the cytoplasm of the cell, and above this cytoplasm, which is red in color, we have the hairs of the cilia. So it is a pseudo-stratified columnar ciliated with goblet cell. Look at this empty space here, it is a goblet cell, and this area, it is the connective tissue which is present under the epithelium. Another type of epithelium, it is a stratified epithelium formed of many layers. It is the transitional epithelium. How can we diagnose this transitional epithelium? You should at first diagnose it is a transitional because it is stratified because it is formed of many layers of cells. Then, if you look, the nuclei are all rounded, the basal and the intermediate and also on the top. These are the rounded nuclei of the top. Look at this and this and this, and the intermediate and also the basal layer. So it is the transitional epithelium, and we can now make it smaller and make a drawing for this epithelium. Here we have the basement membrane, and this is the thickness of the epithelium, and the nuclei here are all rounded. All are rounded nuclei. either the basal or the intermediate or the top layer. So it is the transitional epithelium, which is present, of course, in the urinary passages. Look at this picture also. You will have this epithelium is stratified because it is formed of many layers of cells, as we have many layers of nuclei, more than 2 layers. And here we have the nuclei, especially at the top. Look at the top. If they are rounded and it is a stratified epithelium, so it is the transitional epithelium. Look at the top. It's very evident that they are rounded in shape, so it is a transitional epithelium. Again, another picture for the transitional epithelium. As you see, we have many layers of nuclei, so it is a stratified. Look at the top layer. Here, the top layer, it is formed of cells with rounded nuclei. So they are evident to be rounded, not flattened. So it is a transitional epithelium. Again, this is the transitional epithelium, diagnosed by the presence of multiple layers of nuclei, and the top layer here is showing rounded nuclei. Another picture for another type of epithelium. This is the stratified squamous epithelium. How do we diagnose it? Here we have multiple layers of nuclei. We have multiple layers of nuclei here, and if we look at the top layer, which is present on the surface, you can diagnose that these nuclei are flat. So it is a stratified squamous epithelium. This is another picture for another type of epithelium. Here you can see the multiple layers of the nuclei, so it is a stratified epithelium. And the top layer here, you can see the flat nuclei. You can diagnose the flat nuclei on the top. Perhaps it is not very evident, but we have a very characteristic layer of red stained keratin. So it is a stratified squamous keratinized. So the presence of this keratin, the presence of the flat superficial nuclei, and the presence of many layers of nuclei give us the diagnosis of stratified keratinized stratified squamous epithelium, which is, of course, present in the skin. Also, this is another picture for the epithelium. This is the epithelium and this is the connective tissue. The word epithelium means it is present above connective tissue. Thelium is a connective tissue. Epi means above connective tissue. This type of epithelium is formed of many layers of nuclei, so it is stratified. The top layer is flat, so it is stratified squamous, and it is covered by the homogeneous red material of keratin, so it is keratinized stratified squamous epithelium. Again, it is a stratified squamous keratinized stratified squamous epithelium. This is the keratin, the flat superficial nuclei, the many layers of nuclei, so it is a stratified, and it is a stratified squamous, and it is covered with keratin. And it is written in the exam as a keratinized stratified squamous epithelium. Here it is also a picture for the keratinized stratified squamous epithelium, but the keratin here is much thinner. No problem in the diagnosis. It is also diagnosed as a keratinized stratified squamous epithelium. As regards the low power slides, there are 23 slides for this year. They can be classified into 8 groups. First group characterized by their specific color, and this group includes 4 slides. Second group, small rounded structures and this is formed of 2 slides. Third group, uncharacteristic shape, and this includes 2 slides. Fourth group, characteristic shape and 4 slides. Elongated, just 1 slide. Hollow, 4 slides. With blue tissue, 4 slides. Lobulated structures, 2 slides. This is the first group characterized by their color. The first one in this group formed of 4 slides is the ground compact bone. Take care, it is a very easy slide actually because it is unstained, or it will take a very light yellow coloration in some of the slides, but it is not a stain. But be careful to mention the 2 words ground and compact. Ground, it is the method of preparation, and compact, it is the type of the bone. Also, it is the ground compact bone, but here it is in the form of a longitudinal section, but you are not asked to mention the direction of the sectioning in this slide, but it is characterized by being unstained, and as you see, you can diagnose the Haversian canals, and also we can diagnose the connecting canals formed of these Volkmann's canals connecting the Haversian canals together. Don't be mistaken for this slide because it is a longitudinal section, so it has the same features of the transverse section of the ground compact bone. In the exam, you are not asked to mention LS or TS, just mention it is a ground compact bone. The second slide in this group characterized by the color is this section. This section is the nerve trunk stained by osmic acid. Osmic acid. It is a special stain that should be mentioned in your diagnosis. And it is the only slide in your course which is in the form of a black small dot on the slide. And after seeing it under the microscope, you can diagnose these bundles of the nerve trunks and surrounded with the perineurium. And here we have the nerve fibers or the axons inside the bundle, and we have the white areas representing the endoneurium. So we have epineurium, endoneurium, and the individual nerve fibers. This is the same picture. It is the slide of the nerve trunk stained with osmic acid. As we see, it is characterized by the color, it is characterized by the nature, bundles, and each bundle contains these nerve fibers, very small, they are not evident in the picture, small nerve fibers inside this bundle. Number 3 in this group characterized by the color. In the low power, it is the spinal ganglion stained with silver. As you see here, the spinal ganglion is collection of nerve cells, and these nerve cells are present in groups or in rows, separated by the nerve fibers. And as you see, the nerve cells, the body of the nerve cells, characterized by being large and medium and small, and they are stained brown because of the silver stain. So it is one of the 4 slides characterized by the color. They are characterized by being stained by silver, so brown in color. And to diagnose that it is spinal, the appearance of the arrangement of the cells. They are present in groups or in rows, separated by the nerve fibers. This is another slide, also brown color in the low power, so it is one of the characteristic color. It is not the ground compact bone. It is not the nerve trunk stained with osmic acid. It is either the spinal ganglion or the sympathetic ganglion. When we look for the cells, you can see it is a group, it is a row and a row separated by the nerve fibers, so it is the spinal ganglion stained with silver. This slide also is characterized by the brown coloration, so it is of the group of the characteristic color, not nerve trunk with osmic, not ground compact bone. It is either the spinal or the sympathetic ganglion. You can differentiate between them by looking for the arrangement of the cells. As you see, the cells here are scattered, and they are almost all of the same size. They are all small cells scattered in the section. So the diagnosis of this slide, which is the fourth slide in this group, it is the sympathetic ganglion stained with silver. Now this is the second group in the low power slides, which is a group of the small structures. Just a small structure on the slide. This group includes two slides only: the nerve trunk, which is stained by hematoxin leucine, and the moderator band. This is the picture of both slides by the naked eye. Then you have to differentiate between these two slides. As regards the nerve trunk, the nerve trunk will be formed of bundles of nerve fibers, 3 or 4, and each bundle is surrounded by the perineurium, and inside each bundle you will see the sections in the nerve fibers. These are the sections. They are all of similar appearance inside the bundle, but the other slide is different, which is the moderator band. Here we have one structure, not many bundles. And inside this structure you will notice three things. You will notice a group of fibers which are larger than the others. These are the Purkinje muscle fibers. And you will notice small transversely cut cardiac muscle fibers. And you will notice a blood vessel. So we have three evident structures in this slide: the Purkinje fibers, the cardiac muscle fibers, and the blood vessel present inside this moderator band, in addition to the fact that it is one bundle. Then, when you look to this slide, it is formed of many bundles. Here, it is formed of this bundle, this bundle, this bundle, this bundle, and this bundle. This is the section in the nerve trunk. And here we have the perineurium, and inside each bundle we have endoneurium in addition to the nerve fibers. If you look here, you will see these circles. Each one represents the nerve fiber transversely cut. This slide is different from the previous because it is just one bundle, not many bundles. It's just one bundle. And in this bundle you will notice evident three things. We will notice these fibers, which are larger than the others and surrounded by a connective tissue. You will notice this blood vessel, 1 or 2, and you will notice the transversely cut cardiac muscle fibers, which are much smaller than the Purkinje muscle fibers. So this slide is the moderator band. Also, this is the slide for the moderator band, formed of one bundle, not many bundles, and inside the bundle you can diagnose these large fibers in a pale stained area, and these are the small cardiac muscle fibers present in this moderator band, with the separations of this white septa representing the connective tissue. And also you will find a large blood vessel, at least one blood vessel in this moderator band, large one blood vessel in this moderator band. Then we have another group for the low power slides. We have the group of uncharacteristic shape. This group includes the spinal ganglion, of course, stained with hematoxin leucine, and the cardiac muscle and valve. In this slide of the spinal ganglion, the ganglion may come with different shapes, maybe like this segment, or a segment with an extension like this, or a segment with a extension downwards, or like a comma shaped, or a segment with extension from both ends, or a ganglion here with this line representing the nerve fibers. So it has many shapes, but it has a very characteristic structure under the microscope. The other slide, which is the cardiac muscle and valve, here it may have also this tail, the muscle and the tail, or this bulk of muscle, and underneath it we have this tail. Or it may have the picture like this: ventricular muscle, atrial muscle, and we have here this extension. Here we have the extension of the valve, as you see here. So this is the atrium, this is the ventricle and the valve, this is the cardiac muscle and the valve, this is the cardiac muscle and the valve. In all these conditions also we have a characteristic picture. We will see this ganglion under the microscope after its staining with the methoxide and eosine. It has the same characters. It is formed of nerve cells. These cells are in groups, like this big group, or in parallel rows, separated by the nerve fibers in between. So this is the spinal ganglion. This is the other slide, which is the cardiac muscle and valve. Of course, you should examine all of the slide by moving it sideways. And the most important thing here, you will notice the cardiac muscle, or the muscle here, is cut in different directions. We have longitudinal direction, like these ribbons, parallel to each other, and we have transversely cut cardiac muscle fibers. So we have two directions, not one direction, and in addition, of course, to the presence of the elongation of the valve coming out of this mass of muscle. This is a part from the section of the umbilical cord, and as you see here, we are looking for the vein. Here is the vein, which resembles the mouse or the smiling mouse in the slide of the umbilical cord. This is the picture of the artery, which is always having this stellate shape lumen. This is one of the two arteries, and they look as the eye in the face. So in case of the umbilical cord, the cord appears as if it is a face with two eyes, which are the arteries, and the vein, which is the mouse. And actually this slide is to study the mucoid connective tissue present in between these three vessels, formed of the cells and the abundant mucoid matrix. This is the slide of the costal cartilage or hyaline cartilage, characterized by its specific shape. It looks like an eyeglass when it is formed of two pieces of cartilage surrounded by the red intercostal muscle. But sometimes you will have on the slide just or three pieces of cartilage, so don't be astonished when you see three pieces. And also sometimes you will see one piece only of cartilage. So most commonly you will have two, less commonly you will have three, and less commonly you will have just one piece of cartilage. The red area is the intercostal muscle. Take care that the eyeglass here is more or less intact and not broken. Come at this blue area under the microscope, you will notice, of course, the homogeneous matrix of the cartilage, and these blue dots are representing the chondrocytes. Sometimes you may see these empty spaces. These are blood vessels not supplying the cartilage but passing through it, but it is, of course, it is avascular. Don't be astonished when you see these two empty spaces. And as you see, it is an intact eyeglass, not broken. That's to say, it is differentiated from the spongy bone by the fact that the eyeglass here is intact and not broken, and it takes the blue color of the matrix of the cartilage. Here another slide which has more or less similar shape to the previous one. This is a slide of the spongy bone or rib. Here you can see the two glasses here are present, and actually they should be of a red color, but sometimes this difference is not clear in front of the student in the exam, so you have to differentiate under the microscope. See this very characteristic picture in which the eyeglass here is broken, because here it is a spongy bone formed of the spicules of the spongy bone separated by the bone marrow cavity containing the fat cells. Not homogeneous blue like that of the cartilage. Here the eyeglass here is broken, while the eyeglass of the hyaline cartilage is almost intact. This is the spongy bone or the rib. Also, you can remember now that the eyeglass here also may be formed of one or two pieces or even three pieces. The differentiation between the costal cartilage and the spongy bone is only very evident under the microscope. This is another slide of characteristic shape, which is the growing bone. And as you see here, it is the shape of the bone. It may be transversely laid down or longitudinally laid down. So it may appear like this or like this. However, it is formed of this area of the cartilage, taking the bluish coloration, and then we have this area where the ossification takes place, and finally we have an area of spongy bone inside the upper part of the diaphysis. So in this slide it's very characteristic by its shape, but under the microscope you can diagnose almost all the stages of ossification you have taken in theoretical. By looking at the slide under the microscope, you can see the area of the resting cartilage, the area of proliferation here, the area of the hypertrophy, and area of calcification, and here the start of the ossification by formation of the spongy bone. In another slide, you can see here in the middle of the growing bone the presence of spicules of spongy bone, and in between them we have the bone marrow cells. In another slide also you can see here the spicules of the spongy bone separated by the bone marrow, and of course they are longitudinally cut. Also, this is a very nice picture demonstrating the different stages of the ossification. We have the area of the resting cartilage, we have the area of the proliferation, we have the area of the hypertrophy and calcification with the formation of the spicules of the spongy bone separated by the bone marrow. So all of these pictures are for the growing. Also another picture for the growing bone showing the blue area of the cartilage, the whitish area of the hypertrophy and calcification, and here the area of ossification with the red color. So you will see the different stages. Also the same, the area of the cartilage, the area of hypertrophy calcification, the area of ossification. Now this is the group, another group for the low power slides. It is the group of the hollow organs. In this group, we have 4 slides. We have the aorta, decalcified compact bone, medium-sized artery and vein on the same slide, and basilar artery. Take care that basilar artery is one of the fixed slides. So we have in the fixed slides, we have the nerve trunk, hematoxin and eosin, and osmic acid. We have the moderator band, and we have also the basilar artery. So it is one of the fixed slides. It is fixed with the sellotip on the stage of the microscope so that it is adjusted for you in order not to take so much time in searching for this small structure. Starting by the first hollow structure is the aorta. Here you can see that it is formed of a wall reddish in color, and the cavity inside the lumen is white or empty. And you don't have anything attached on its surface. You will look for this red wall under the microscope, and by looking at it you will notice that it is formed of many wavy elastic fibers. In between you have the blue dots representing the nuclei of the smooth muscles. Inside the lumen it is more or less empty. So, empty lumen and wall formed of parallel red elastic fibers separated by these nuclei of the smooth muscle fibers. Again, this is the picture for the aorta, and as you see here, the wall is reddish in color, the lumen is empty completely, and you will see here in the wall the parallel red elastic fibers coiled, and we have also, or folded, and we have in between nuclei of the smooth muscle. Another picture also for the aorta. As we see here, the elastic fibers are very evident. They are wavy, acidophilic in staining, and in between you can see the nuclei, these blue nuclei of the smooth muscle fibers. The lumen is empty because it was occupied by the blood, and nothing is attached to the wall of the aorta. Again, this is a picture for the aorta under the microscope, and you can diagnose very clearly the wavy elastic fibers red in staining, and in between we have the blue dots of the nuclei of smooth muscle fiber. The second slide in this group of hollow structures is the decalcified compact bone, and half a mark will be the word decalcified and half a mark for the word compact. In this decalcified compact bone, you will see that we have the red structure, which is hollow, which is the substance of the bone itself, and in the lumen you will notice either small amount or large amount of the bone marrow. Sometimes, and not always, you will see a muscle attached, part of the muscle attached to the surface. So, in this, under the microscope, you will see the bone marrow very evident in the cavity and characterized by the presence of many fat cells, as it is a yellow bone marrow, in addition to the hemopoietic tissue in between. Most important is looking for the wall of the bone, and this bone will be formed of the Haversian canals. Here, these rounded structures are the Haversian blood vessels. They are the Haversian blood vessels, and they are surrounded by the nuclei of the osteocytes, 1 or 2 circles. This is completely different from the wall of the aorta, which was characterized by the presence of the wavy red elastic fibers, and in between them we have the nuclei of the smooth muscle fibers. And also in the lumen of the aorta, I don't see a bone marrow at all, while in the lumen of the decalcified compact bone, I will notice the bone marrow. This is the third structure in this group of hollow organs, but actually it is formed of 2 structures coming together, which is the medium-sized artery and medium-sized vein. And in between we have an areolar connective tissue. The medium-sized artery is the one with the thick wall and narrow lumen, and the medium-sized vein is the one with the thin wall and wide lumen. Here we have a close picture for the artery alone, and you can see here that it is characterized by the presence of internal elastic lamina causing folding of the end. Here we have the media of a dark color and the externa of the white or the pale color here because of the presence of areolar connective tissue or loose connective tissue in between or in this layer. Here this is the artery. To the other part of the slide, you will notice the vein characterized by thin wall, wide lumen, and the intima is more or less straight, no elastic lamina inside it, and the media is very, very thin, just 1 or 2 layers of smooth muscles, and then we have the externa formed of the areolar connective tissue. Here we have the last component or last structure in this group, the group of hollow organs, which is the basilar artery. The basilar artery comes alone with no vein. The basilar artery is one of the fixed slides because it is small, and we want you to look at it very rapidly, so it is fixed with the cellotape. Under the microscope, it has a very characteristic picture, which is the thick, well-developed internal elastic lamina. And the media and externa are almost similar to each other. The wall is thin. So this is the basilar artery. Also, this is the basilar artery, thin wall, and also it has a very folded elastic lamina, and it comes. This is also the basilar artery under the microscope, characterized by the presence of this well-developed internal elastic lamina forming a corrugation like this, and the thin media equal to externa, and it comes. Now we will move to another group formed of only one slide at this here, which is the elongated structures. These elongated structures are only one slide, which is the LS in the skeletal muscle fibers. The muscle fibers appear parallel ribbon as we see, and they are red in color. So in this picture we have here the parallel longitudinally sectioned skeletal muscle fibers, and in between we have this white area. They are representing the place where the connective tissue was present, but it was cut during preparation of the section. So we don't have any slide formed of parallel red ribbons with white separations like this in your sections. Again, this is the LS in the skeletal muscle, elongated structure formed of the parallel red muscle fibers, and of course you know that these white area are representing the destroyed connective tissue in between the muscle fibers during the preparation. Again, it is LS skeletal muscle fibers, but let us concentrate slightly. Here you can see the skeletal muscle fibers, and you can notice these blue dots. These blue dots, some of them are the nuclei of the skeletal muscle fibers, and some of them are the nuclei of the endomysium. So this is the LS of the skeletal muscle fibers. Now we have the group with blue tissue inside. This group includes the following slides. It includes the number 1, the lymph node, number 2, the spleen, number 3, the tonsil, number 4, the ear pin. Here these 4 structures are characterized by having blue tissue inside. Actually, the first 3 slides contain lymphatic tissue, while the 4th slide contains cartilage. If we look at the first slide, you will notice that it is almost kidney or bean shape, and it has a dark blue tissue on the surface while the center is red in color. So it is covered by the blue tissue at the cortex, and the red center is the medulla. In the second slide, this slide almost always it is a spindle in shape, but it is characterized by having the blue dots scattered on the surface, not only at the cortex. They are uniformly scattered on the surface, while in the lymph node they are present only these blue dots or circles or follicles are present at the top only. In the third slide, it is curved, almost like S-shaped, and it is blue in color, but at one side it is covered by the mucous membrane, which is red. The fourth slide, also curved, like the stick of an old man, and it is formed of the skin, which is of red color, and the blue cartilage is present inside. We will start discussing one by one under the microscope. The first slide, which is the lymph node. If you look at the lymph node, here you can diagnose the follicles, the blue follicles present only on the surface, while in the center we have these spicules of medullary cords. So we have follicles on the surface, and the medulla is mostly red in color with the presence of these spicules, ashwak of medullary cords in the center. Here also it is a picture for the lymph node in the medulla, and you can see these spicules of medullary cords, and we have this is the medulla, but the cortex is in another view. So if we have rounded follicles on the surface and the spicules in the center, it is the lymph follicle. Here we have follicles, but these follicles are scattered throughout the section. All of the section is formed of these blue follicles. And if you look carefully in each follicle, you will diagnose this blood vessel, which is called follicular arteriole. And in between these follicles, blue follicles, we have the red area representing the red pulp of the spleen. Also, this is a picture for the spleen, and you can diagnose carefully the presence of the follicles scattered throughout the section. And if you look at any follicle or most of the follicles, you can see the follicular arteriole, mostly at one side of the follicle, and in between you have these blood sinusoids, and this is the structure of the red bulb. The other slide, the third slide here, it is the slide of the tonsil. Actually, from the naked eye picture, the tonsil looks like an S-shaped blue in color, but on the surface of this blue structure I have a red tissue, which is the mucous membrane. Here I am concentrating on the mucous membrane on the surface of this blue lymphatic tissue. You can see here two important things to diagnose the tonsil. We have the stratified squamous epithelium, and we have the mucous glands. So we have two things: blue tissue covered by this stratified squamous, and we have this pale mucus. This is the last slide in this group, which is the ear pin. As you see, you can diagnose the blue or faint blue elastic cartilage. And on both sides you can see the hair follicles, so it is the ear pin. Another picture for the ear pin, you can see here the yellow elastic cartilage. Mostly I have these lines which are due to the shrinkage of the tissue and forming an overlapping in these lines. This is the yellow elastic cartilage. It is faintly stained here, but most probably in the slides of the exam are more evident. And here we have, on both sides, we have the skin. And in the skin, you will see hair follicles here and there. The last group here is the group of the lobulated structures. And these lobulated structures are formed of lobules. They are separated from each other by fine white spaces in between them, representing connective tissue septa. The first one is the thymus, and the second is the TS in the skeletal muscle. This is the first slide on the right side, which is the slide of the thymus. The thymus here appears in the form of lobules. Here we have these lobules, and if you concentrate on the lobule carefully, you will notice that it is dark at the periphery and paler in the center, or blue at the periphery, red in the center. So it is very characteristic for the thymus. It is a lobulated structure, and the lobules here are formed of blue cortex and red medulla. While in the other section, which is the TS and the skeletal muscle, you can find out that the lobules, all of the lobules, are of uniform color, and they are separated by very relatively wide areas representing the damaged connective tissue septa which was present in between. So we have two lobulated structures, the thymus and TS in the skeletal muscle. Don't forget the word TS, because I have an LS skeletal muscle, which was an elongated structure. So in this slide you have to specify it is a longitudinal section or a transverse section, as this identification will take half of the mark. If we look at this section in the thymus under the microscope, you will notice this dark periphery, which is the cortex of the thymic lobule, and the pale center, which is the medulla. Of course, this is dark because it contains a huge population of the lymphoblast and the lymphocytes, and here we have less number of the lymphocytes, so we have a dark periphery and a pale center. And these white areas are representing the connective tissue that was damaged during preparation of the section. Also, this slide, the same information, but it is concentrating on few lobules only. We have this lobule in which we have a dark cortex here, and this is the medulla, and as you see, the medulla is communicating sometimes between different lobules. So a lobules with a dark blue and red center is for the slide of. But here we have another picture. We have also lobules, but these lobules, if we look at them, these lobules are more or less of normal red color with blue dots representing the nuclei of the skeletal muscle fibers. Another picture for a transverse section of the skeletal muscle, and it is very, very evident. As you see, you can find the bundles of the skeletal muscle fibers, and they are transversely cut, of course. The fibers are here more or less polygonal in shape, and they are separated by this white area representing the damaged connective tissue. Also, another picture of the transverse section in the skeletal muscle, formed of bundles separated by this white area of connective. Finally, thank you very much, and I wish you all the best because you are the best.